Another bone of the face or facial bone is the zygomatic bone. And for the zygomatic bone, the two zygomatic bone, commonly called cheekbone or cheekbones, form the prominences of the cheeks and part of the lateral wall and floor of each orbit. So we were able to identify the maxilla forming part of the orbit, and as well we have here with us the zygomatic forming the floor of each orbit. They articulate with the frontal, maxilla, sphenoid, and as well the temporal bone. So let's get to the skeleton of the skull so that we can at least have to know where exactly this zygomatic bone is located. So for us, we have the anterior view of the skeleton, and the zygomatic bone is painted with brown, if I'm not wrong, and this is the location of the zygomatic bone. And this is the left and the right part, and we at least have some few structures within the zygomatic bone. And for us, we have the zygomaticofacial foramen located right here. So this is the zygomatic bone, remember, and that's all about that. As we'll be moving ahead, we'll find other facts or the surface anatomy regarding that bone. This is the maxilla, the nozzle, and other bones. So the frontal dominates this anterior part or the anterior portion of the skull, and we were able to read about them as we were presenting the previous slides. So for the lateral view, we have with us the zygomatic bone, which dominates this location. This is the zygomatic bone. This another architecture of the skull, and it's presented by the lateral aspect. And with us, we have the zygomatic bone in orange, and the zygomaticofacial foramen are located around here, which is most commonly found within the zygomatic bone. So let's get to the descriptive part. And for us, we have the frontal process raises vertically and separates the orbit and the temporal fossa, only for some little errors, but well, I'll be presenting or I'll be giving out notes. It's much updated. You'll never find this some small errors. The temporal process of the zygomatic bone projects posteriorly and articulates with the zygomatic process of the temporal bone to form the zygomatic arc. The maxillary process extends towards the midline, forming the inferolateral orbital margin. So let's get to check at least this frontal process, temporal process, and the maxillary process, of which we've been able to identify their best description. So for with us, we have the frontal process, which is right here. We have the maxillary process, and we have the temporal process, and as well other structures, including the masseteric origin, maxillary process, I've mentioned that. Then we have the zygomaticofacial foramen, which is definitely located there. We have the zygomatico-orbital foramina, which is found within this area, and as well we have the zygomatico-temporal foramen, which is the same as which is located right there. So this is the lateral aspect of the right zygomatic, and then we have the medial anterior is to the left. Zygomaticofacial foramen perforates the convex lateral surface of the zygomatic and are often multiple. Zygomaticofacial nerve, a division of cranial nerve 7, and vessels pass through this foramen. Masseteric origin, of which we've been able to check, or we can go back and see. So we have the masseteric origin. So what's all about this part? So we have with us is the roughened expanded inferior edge of the bone extends from the zygomatical maxillary to the temporal zygomatic suture, and on the temporal, this is the main attachment of the masseter muscle, which is a major elevator of the mandible. So that's all about this part, which is the masseteric origin. Zygomatic orbital foramina perforates the inferolateral corner of the orbit cavity for passage of zygomaticotemporal and the zygomaticofacial nerves, also a division of cranial nerve number 5. Zygomaticotemporal foramen is centered in the temporal surface of zygomatic, and it transmits the zygomaticotemporal nerve. So we have at least two bones which are described here, zygomatic and temporal. So the two names combine to form zygomaticotemporal.